Hello everyone. Today we'll discuss the analysis of influenza deaths in the United States for the period of 2009 until 2017 and staffing strategies to address the healthcare demands during the flu seasons. The United States of America has been experiencing an annual influenza season during which a higher than normal number of people contract the flu. Vulnerable individuals often face severe complications, sometimes leading to fatalities. Hospitals require extra staff to handle the increased patient load each season, with temporary medical staffing agencies to provide the additional support. Our main objective here is to decide when to deploy the staff and how many to send to each state. For this, we have done the analysis from the data of the death rates per age group, per state, and according to the population rates. When we look here, the first slide, the data shows the total flu deaths have peaked in 2015 and the deaths are about 73,759 with over years showing fluctuations with a minimum of 67,345 deaths. This consistent trend of high flu deaths emphasizes the need for efficient healthcare resource management, particularly in high risk seasons. When we break down the deaths by age group, who is affected more? The highest impact is seen in the age groups of 65 plus, and the deaths are about more than 400,000 as per the records. This demographic is particularly vulnerable, reinforcing the need for targeted healthcare staffing in regions with larger elderly populations. And when we look at the 65 age group per state, we see that the 65 group influenza deaths per state shows like this. California has the highest number of deaths and the number is about 47,483, followed by New York with 36,576, and comes the next Texas with 22,140. These states, along with the others like Florida and Pennsylvania, require priority in staffing due to its high mortality rates. When we look at these age groups per state, the heat map shows that the states with the darkest shading, such as California, New York, and Texas, represent the highest influenza deaths among other populations. These regions should be the first to receive additional staff during the flu season. And when we have to recommend the staffing based on the flu death rate, we recommend the priority staffing and high priority states such as California, New York, and Texas, followed by Florida, Pennsylvania, Ohio, and Illinois, needs more, more staffing. And when we discuss about the timing, additional staff should be deployed in peak months like October and November to manage the influx of the patients during the flu season. If we have to conclude, vulnerable populations, particularly those aged 65 and above, are most affected. Analyzing staff to patient ratios can help prioritize where the additional staffing is needed to ensure the quality care during the peak influenza seasons. Thank you.